Good morning, Dr. Ferguson coming to you from the Passioncam. Many of you have been following my Passioncam and enjoying it, and been having a lot of questions about saliva testing. As many of you know, I do a lot of natural hormone therapy, and saliva testing is the foundation on how I decide how I'm going to treat the individual patients. Now, saliva testing is unique in that it gives us the amount of free hormone in your body, whereas the blood test, much of your hormone is going to be bound to protein. So we don't really get the number that we want to work with. The amount of free hormone is the amount that we can actually work with. Now, when you talk about saliva testing, men and women have all the same hormones. And depending on what I'm looking for or what I'm looking to treat, it's depending on how many hormones I might order or what I might be looking for. For example, if I'm looking at a woman that may have some depression and also feels she's having some hormonal symptoms, whether it be young, whether it be old, then I'll usually get a testosterone, a DHEA, cortisol. I'll get 4 different levels, one in the morning, afternoon, evening, and night, and I'll get an estrogen and a progesterone. So I'll usually get 8 hormones on that particular person. If it's a man, I might check testosterone, estrogen, DHEA, and let's see, I'm missing one. So if it's a man, I might check estrogen, testosterone, progesterone, and DHEA. Where if I'm looking at depression, then I would also add the 4 levels of cortisol, which would be in the morning, afternoon, evening, and night. And so I do the saliva testing, I get the results back, and I treat accordingly. Whatever's deficient is what I begin to treat. So if I do your saliva test, we get it back, and we find that you have some deficiencies in testosterone, estrogen, then we'll treat testosterone, estrogen. If we find we have deficiencies that are more associated with depression, and that's a little different, and there's a little more things we have to add to that. But all in all, I use the saliva testing as a foundation from which to start in treating my patients for natural hormone therapy. I'll talk more about this next time. In the meantime, be blessed and have a wonderful day. Bye-bye.